2024, the FDA approved a new first-line treatment for mesothelioma, pembrolizumab combined with pemetrexed and platinum chemotherapy. This combination, based on the IND 227 trial, showed impressive response rates and represents another major advance in mesothelioma treatment. Today, I want to explain what this combination is, how it differs from other immunotherapy options, what the IND 227 trial showed, who should receive this treatment, and how to decide between this and other first-line options. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding this new FDA-approved combination helps you make informed decisions about first-line treatment. So let's start with what this combination actually is. Pembrolizumab is sold under the brand name Keytruda. It's a PD-1 inhibitor immunotherapy drug. That's a similar mechanism to nivolumab, but a different specific drug. Both block PD-1 checkpoint proteins, allowing immune cells to attack cancer. The new regimen combines pembrolizumab with standard mesothelioma chemotherapy of pemetrexed plus either cisplatin or carboplatin. You receive all three drugs together rather than choosing between immunotherapy or chemotherapy. The rationale for combining immunotherapy with chemotherapy is that they work through complementary mechanisms. Chemotherapy directly kills cancer cells and can make tumors more visible to the immune system by releasing tumor antigens, while immunotherapy enhances immune attacks on cancer. The idea is that together, they might be more effective than either one alone. The IND 227 trial, also called DREAMM-3R, was a phase 2 trial that led to FDA approval. It enrolled patients with previously untreated, unresectable pleural or peritoneal mesothelioma. All patients received the same dose of pembrolizumab plus pemetrexed plus either cisplatin or carboplatin every 3 weeks. The primary endpoint was finding out the objective response rate, which means the percentage of patients whose tumors shrank by at least 30%. The results were impressive. 62% of patients had objective responses, meaning their tumors shrank significantly. This is much higher than the 30 to 40% response rate typically seen with chemotherapy alone. Now, before I go on, I'm going to take a break and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, the disease control rate, including both those who responded and those whose disease remained stable, was even higher, at about 90%. Median progression-free survival was approximately 7 to 8 months. Overall survival data takes a little time to accumulate, so it's still being assessed, but it appears to be favorable. And unlike the CheckMate 743 trial, which was only conducted on patients with pleural mesothelioma, the IND 227 trial included both pleural and peritoneal mesothelioma patients. Both epithelioid and non-epithelioid patients were included and showed particularly good responses in epithelioid disease. Based on these results, the FDA approved pembrolizumab in combination with pemetrexed and platinum chemotherapy in October 2024 for adult patients with unresectable pleural or peritoneal mesothelioma. What does treatment involve? You receive all three drugs intravenously. On day one of each 3-week cycle, pembrolizumab is infused over 30 minutes, pemetrexed over 10 minutes, and either cisplatin or carboplatin is infused over 1 to 2 hours with extensive IV hydration if it's cisplatin. Treatment with pembrolizumab continues for about 2 years over up to 35 cycles or until disease progression or unacceptable toxicity. Some patients just go with chemotherapy and others continue pembrolizumab as maintenance. You must take folic acid daily and vitamin B12 injections every 9 weeks while receiving pemetrexed to reduce side effects. Dexamethasone is given before and after pemetrexed to prevent a bad rash. What side effects should you expect? This combination causes both chemotherapy side effects and immunotherapy side effects. From chemotherapy, you can expect fatigue, nausea, reduced appetite, low blood counts, including anemia, neutropenia, and thrombocytopenia, possible kidney damage, especially with cisplatin, and peripheral neuropathy, especially with cisplatin. From the pembrolizumab, immune-related adverse events can include diarrhea, colitis, pneumonitis, hepatitis, thyroid dysfunction, skin rash, and other immune-mediated inflammation. The combination of both sets of side effects means overall toxicity can be substantial. In the IND 227 trial, serious adverse events occurred in about 40 to 50% of patients, but most of those side effects were manageable with dose modifications, treatment delays, and supportive care. The incidence of immune-related adverse events appears somewhat lower than with dual immunotherapy, which is nivolumab plus ipilimumab, possibly because pembrolizumab alone is less immune stimulating than the dual combination. How do you decide between pembrolizumab plus chemotherapy versus nivolumab plus ipilimumab? These are both FDA-approved first-line options, but there's no head-to-head trial comparing them directly. For epithelioid mesothelioma, pembrolizumab plus chemotherapy might be preferred based on the high response rate shown in IND 227. The 62% response rate is impressive, and it suggests this combination is particularly effective for epithelioid disease. For sarcomatoid and biphasic types, which are the non-epithelioid mesotheliomas, nivolumab plus ipilimumab has strong data from the CheckMate 743 trial showing dramatic survival benefit over chemotherapy. The dual immunotherapy approach without chemotherapy might be preferred for these aggressive cell types. Patient factors matter. If you have kidney problems or neuropathy concerns, avoiding cisplatin by choosing dual immunotherapy might be better. If you have an active autoimmune disease, you might not tolerate immunotherapy well, and chemotherapy alone could be preferable. Some patients prefer avoiding chemotherapy side effects if possible, and they choose dual immunotherapy. Others feel more comfortable with a regimen that includes proven chemotherapy and choose pembrolizumab plus chemotherapy. Now, what about for peritoneal mesothelioma? IND 227 included peritoneal patients and showed good responses, which makes pembrolizumab plus chemotherapy a reasonable option. However, for peritoneal patients who are surgical candidates, cytoreductive surgery with HIPEC remains the gold standard, with dramatically better outcomes than any systemic therapy. But systemic treatment with pembrolizumab plus chemotherapy would be appropriate for peritoneal patients who aren't surgical candidates due to extensive disease, poor health, or other factors. What if you start one regimen and want to switch? Switching between first-line regimens without clear disease progression is generally not done. But if you start dual immunotherapy and develop intolerable immune-related side effects, switching to chemotherapy alone is reasonable. Or if you start chemotherapy immunotherapy and chemotherapy side effects are intolerable, stopping chemotherapy and continuing the pembrolizumab alone might be considered. What happens after first-line treatment? If you receive pembrolizumab plus chemotherapy and your disease eventually progresses, second-line options include continuing pembrolizumab alone if you are still tolerating it, trying a different chemotherapy drug like gemcitabine, clinical trials, or best supportive care depending on your condition. What questions should you ask about this combination? Ask, why are you recommending this versus dual immunotherapy or other options? Ask, given my cell type and disease characteristics, which first-line regimen do you think is best? Ask, what response rate and survival outcomes can I expect? What are the most common serious side effects? How will side effects be monitored and managed? Can I stop chemotherapy after several cycles and continue pembrolizumab alone if I'm having chemotherapy side effects? Pembrolizumab plus pemetrexed plus platinum chemotherapy was FDA approved in 2024 based on the IND 227 trial, which showed a 62% objective response rate that was dramatically higher than chemotherapy alone. It combines a PD-1 checkpoint inhibitor with standard chemotherapy to take advantage of their complementary mechanisms. It's given via IV every 3 weeks for up to 35 cycles. It can cause both chemotherapy and immunotherapy side effects. It's particularly effective for epithelioid disease and is an alternative to nivolumab plus ipilimumab dual immunotherapy. Deciding which is best for a particular case depends on cell type, patient factors, and preferences. For peritoneal disease, surgery with HIPEC remains preferred if eligible, but this treatment is best for non-surgical candidates. You can visit mesothelioma.net for more information about pembrolizumab combination therapy and other mesothelioma treatments, or call 1-800-692-8608 or use the live chat feature on our website to work with one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.